Welcome to Kathryn Raaker's World. Innovation, culture, adventure, fashion and health, artists, destinations, traditions. This is Kathryn Raaker's World.
Hi, this is Kathryn Raaker of Kathryn Raaker's World. You know, living with COPD doesn't have to mean a life of breathlessness. This COPD Awareness Month, a pulmonologist and a patient encourage COPD patients to speak up and take control of their symptoms. Our guests are Dr. Thomas C. Corbridge, MD, medical expert from GSK and pulmonologist in Chicago, Illinois, and Candice Norris, COPD patient. And Dr. Corbridge is a medical expert, like we said, from GSK and pulmonologist in Chicago, Illinois, affiliated with multiple hospitals in the area, including Northwestern Memorial Hospital. He's an adjunct professor of pulmonary and critical care at Northwestern University, Feinberg School of Medicine. He received his medical degree from the University of Chicago, Pritzker School of Medicine, and has been in practice for almost 30 years. Candice Norris is a 64-year-old wife and mother who was diagnosed with COPD in 1996. Both of her parents died from COPD, and her sister is also currently diagnosed with COPD. I want to welcome you to our show today, both Dr. Corbridge and Candice. How are you today?
I'm wonderful. Thank you for asking.
Doing well.
You're
Thanks
welcome.
for having us, Candice.
Yeah.
Thank you. Dr. Corbridge, we're going to start with you, and then Candice, okay? Dr. Corbridge, what is COPD and its symptoms? Because there's a lot of people that don't really know and understand it. Can you tell us?
Sure. So COPD stands for chronic obstructive pulmonary disease. It is an umbrella term that really is meant to encompass two other more specific terms, one being emphysema, which would be loss of lung tissue or holes in the lung, and also chronic bronchitis, which speaks to the disease's effects on the bronchial tubes, the bronchial passageways, where they can become inflamed and narrow. And patients have a variable combination of these to create the most common symptom of COPD, which is shortness of breath. Often that's kind of peppered by flare-ups or periods of times of exacerbation where there's a downturn in symptoms.
And why is it so important for patients like Candice to speak openly and honestly about their COPD symptoms with their physicians?
Yeah, that is such a great question. So we know that the earlier that you come in to get help, the better. You know, there is definitely treatment to be had. And the sooner you get in and the more honest and open that a patient can be about where they are in their journey really helps the physician. So we want to know more about how they are from a shortness of breath perspective, what they can do functionally. Are they able to still climb stairs? Can they walk down the street? Really getting into more probing questions about their degree of breathlessness. And we really need to understand about these flare-ups or exacerbations, because those, if you have them, predict ones to come. And those can cause an additional damage to the lung. So fully understanding where patients are helps us to craft really the best treatment plan. And the earlier, the better.
Now, what are some tips to help patients initiate that conversation with their physician? And, you know, don't be afraid, right?
You know, that is such good advice. You know, we want that kind of trusting relationship, that open relationship, and it really, you know, requires, patients to kind of understand where they are, to try to think about the symptoms as truthfully as they can, so they can report those symptoms to their physicians. Physicians want to know, are not going to be judgmental. They really want to know where people are so that they can design and craft that best treatment plan.
And you want to be able to be comfortable with that physician, don't you, doctor?
Yeah, so the patients when they have that interaction with their physician, want to have that comfort level, want to be able to have that open and honest interchange. The physicians may ask some additional probing questions, but really through that interchange, that's the start of a relationship that gets them on the best treatment plan.
Now, what does a comprehensive COPD disease management plan look like, doctor?
Yeah, and it really is multi-dimensional. So it starts, I would say, with patients getting in early, establishing that, that trusting relationship with a provider. Certainly, smoking cessation if patients are still smoking, appropriate vaccinations, returning back to exercise, regaining their ability to do things throughout the day, and maybe even formally enrolling in a pulmonary rehabilitation program. And then medications unique to them as guided by that relationship with their physician.
Thank you so very much, doctor. And these questions are for you, Candice. What led you to speak more openly and honestly with your doctor about the impact your COPD symptoms had on your life? And did your family have anything, since both your parents died of COPD and your sister is diagnosed, did that make you want to find out?
Yes, ultimately it did. I had many flares, typically about every 2 years, and I'm aware that they do more damage each flare you have, and I finally made the decision that I wanted to control the symptoms and no longer allow it to control me. I have a family that I love, and I wanted to be there for them, and you have to develop a relationship with your doctor, have your family as an advocate for you, because you can't always speak well when you're low on oxygen, and develop that exercise program and just keep moving, and because life is there to live, and it's more difficult to do if you cannot breathe.
Can you tell us how you changed the way you manage your disease since you found out in 1996?
Well, number one, I quit smoking. I decided to put that aside. I knew that was a main problem. I decided to be more honest with my doctor and not to feel judged or embarrassed that I felt that I brought this on myself. I knew that exercise would really help, so my son and I developed an exercise program. I participate in 5Ks, I watch what I eat, and I just all around try to stay as healthy as possible now, because I know that will prevent more flares, which create more damage in the long run.
Tell us about your own COPD disease management plan, if you don't mind.
Oh, not at all. Well, it's pretty much exactly as I stated, that I do exercise a lot. I work full time. I think keeping movement going helps overall. Like, I watch what I eat. I just try to keep beyond the next flare. I take my medications as prescribed, that my doctor prescribed for me. I try to just stay a step ahead of any flare that might happen. I keep aware of how I'm feeling. I let my family know. They're definitely an advocate for me, and they're just there to help, and that's what I do.
And in your experience, why is it so important to speak up about your COPD? And were you worried when you first went to the doctors?
Originally, no, I wasn't worried. I kind of pushed it aside. But you ultimately have to face it head on, and you have to battle the symptoms. You have to fight back. So you need to take control of the symptoms that are occurring. You have to let your doctor know before it gets serious, because it can get very, very bad. When you're that breathless, it's like trying to inflate a brick, which, as you can imagine, is almost impossible. So you need to get to your doctor and be honest before it gets to that point.
Right, and smoking doesn't help at all, does it?
No, not at all. It is difficult to quit, but it can be done.
I know. I quit when I was about 20 years ago. I feel great.
Good for you.
And I can breathe easier. I mean, it's unreal. So what's your advice to others living with COPD who may not be speaking honestly with their physicians and should expect more?
the physician can only work with the information you give them. So you need to be honest with them. They can take the information you give them and develop a great treatment program for you, and that's what mine has done. They're going to encourage you to keep moving, and you need to be cautious. You need to have a exercise buddy if possible. You need to be aware of where you're at, and involve your family. They're there to help you also. It's primary to have an advocate for you, because there's sometimes that you can't speak for yourself. Trust your doctor that they're there to help, and just keep moving. It's only going to help you.
And Doctor and Candice, where can our viewers and listeners go for more information about living with COPD?
I think we would recommend you go to copd.com, which is a really terrific website. There's a wealth of information there to help patients kind of navigate in different directions depending on where their questions are. It may help them prepare for that clinic visit to come, to understand what good questions they should ask and what things they should be reporting to their physicians.
I can't thank you both enough for joining us today on Kathryn Raaker's World and sharing your story, Candice and Doctor. It's so important to get this information out there, and actually taking those steps to meet with your doctor or your physician.
Absolutely.
Correct?
Absolutely. Earlier the better.
Okay, the earlier the better, to make it easier on you. And if you're smoking right now, give it up. It's well worth it.
That's right, Kathryn.
It is, yes.
Thank you. And we'll be back after these messages on Kathryn Raaker's World.
Hi, this is Kathryn Raaker of Kathryn Raaker's World. We're honored to have with us today on location in Dallas, Texas for the Skyball Weekend provided by the Air Power Foundation, the American Airlines, and a lot of other sponsors. Kim Mitchell, CEO of Veterans Village of San Diego. Welcome to our show, Kim.
Thank you. Great to be here.
I am so excited to talk to you, and I'll tell you why. Not just because of your organization, because of your history yourself. I happen to be from the Vietnam era, actually. And I had a lot of friends that passed away in Vietnam, but I have a lot of friends that adopted children and brought them back to the United States. Can you tell us your story? Because that's where your history starts, correct?
It sure does. I'd be happy to tell it.
Go ahead.
So in 1972, when the North Vietnamese were advancing the Quang Tri, a South Vietnamese Marine and his company were assigned to evacuate the village and blow up the My Chang Bridge, which was just south of the village. Right after they evacuated the village and right before they blew up the bridge, one last survivor stumbled across the bridge. And when they went to investigate, they realized that it was a man carrying a bundle, and that bundle was a baby wrapped up in a towel and placed in a hat. And when this South Vietnamese Marine and his company asked this gentleman, "Is this your child?" He said, "No, I found her along the side of the road, trying to nurse on her dead mother." He said, "But I can't go any further." He said, "You need to take this child, save this child's life. There's an orphanage in Da Nang." So this South Vietnamese Marine took it upon himself to commandeer one of the company jeeps and take this child from Quang Tri down to Da Nang, and where there's a Sacred Heart orphanage run by Catholic nuns. And he presented the child to the nuns, and they said, "What is her name?" And because she doesn't have a name, but she's found along the side of the road, they said, "You brought her here. You give her a name." So he gave her the name of Tran Thi Ngoc Bic, which means precious pearl. A few months later, a U.S. airman who was stationed at the air base in Da Nang came over to the orphanage, and as many servicemen and women did during the time, brought gifts, brought clothes, brought food, brought water, just something to pass the time. And when he placed the gifts into the nun's arm, they placed baby number 899, known as Tran Thi Ngoc Bic, into his arms. And that day must have been a very special day because he fell in love with that child and decided to adopt her. And in 1972, in September, I was adopted and brought over to the United States to start my new life.
That's the little girl
That's
that
the
was
little
in the
girl.
blanket.
That's right. And so the next 6 years, my dad was in the Air Force, and so we kind of traveled around as Air Force and military families do. Traveled around and as an Air Force brat, and then my father retired, and we moved up to northern Wisconsin because that's where my mom was from northern Wisconsin. And when we were growing up in northern Wisconsin, I did everything that northern Wisconsin kids did. Played in the snow, built snowmen, things like that. But I always knew that I had something a little bit different about my background. I didn't quite look like everyone else in my class in northern Wisconsin.
Right.
I do know what bullying is like, because all of a sudden when kids start growing up and they realize that maybe somebody looks different, they make it a point to use that against them.
Right.
And so for me in 7th grade is when the bullying happened. But it helps me understand now what people can do to make someone use that power of intimidation, of humiliation, to make a point that you might look different and act different.
What did you do to combat it? Do you remember?
I focused on other activities of organizations like 4-H and basketball,
Right.
or organizations that were accepting of who I was and what I looked like. It didn't matter. I was a northern Wisconsin kid.
Yeah.
I knew I had a life of service, and so I was focused on joining the military when I was going through high school. My dad wanted me to go to the Air Force Academy. I decided,
and you didn't want to.
I decided that the only form of rebellion would be going to be the Naval Academy, and so I applied to the Naval Academy, and I got accepted. And 2 weeks before I reported into the Naval Academy, my father was struck by lightning and killed on our farm.
Oh, I'm so sorry.
So I understand what happens to families when someone is taken from them, but I also understand the power of a community and how they can come together, and how it's so vitally important for community support to support those families. And so the Navy gave me a year off from the Naval Academy, and I was able to spend time with my mom and my brother, and then I was reaccepted into the Naval Academy and graduated in class of 96.
Okay.
And spent 17 years as a surface warfare officer, doing various ships, tours on board ships and tours at shore, mostly in Washington, D.C. at the Pentagon.
Right.
My last 2 years, 2010 to 2012, I was the deputy for the Warrior and Family Support Office, working directly for Admiral Mike Mullen, the chairman of the Joint Chiefs of Staff.
Oh, that's pretty awesome.
In that capacity, I traveled to 329 communities looking for resources and services and programs for veterans, military families, and families of the fallen, which is actually how I first came in contact with American Airlines and Air Power Foundation and attended my first Skyball in 2010. And it was because of this nationwide network of support that I knew that I now had a passion to continue to do whatever it was that I was going to do. It was going to be to serve and continue to serve our veterans and our military families, finding resources, finding programs that were effective, finding ways to ensure that they could be successful and happy and healthy with their families back in the community after they transitioned. In 2012, I got out of the military and co-founded a nonprofit called Dixon Center, which I still worked with communities all across the country. And in 2017, I applied to the opening that came up, which was the president and CEO of Veterans Village of San Diego. I was fortunate enough to be offered the job and position as the first non-Vietnam veteran, first female CEO of the organization.
Wow.
And to take this organization that was founded by 5 combat Vietnam veterans, 4 Vietnam veterans, and now serves all generations of veterans, and for me to come in as the new CEO, the leader with vision of change, which is what they wanted. It was a very humbling experience for me. But I see this as a full circle for me to be able to not only be here because of our Vietnam veterans, which I owe everything. I am their legacy.
You are.
Of the Vietnam veterans, to be able to now run an organization that was founded through them, by their leadership, for now all Vietnam veterans. I'm very, very honored and very proud to be able to do so. I have a strong passion with working with other organizations that serve our veterans and our military families. So I am on the board of directors for Infinite Hero Foundation, which is a very good friend of the Air Power Foundation. And we'll see tonight when several iBots are presented to some of our wounded warriors, which is Infinite Hero Foundation, in partnership with Air Power Foundation, is going to be able to present these iBots to these wounded warriors, because it's getting them the services and tools so that they can live happy and healthy lifestyles. Right. I assist Medal of Honor recipient Herschel Woody Williams, the last living Medal of Honor recipient from the Battle of Iwo Jima. I am on his board of directors to recognize Gold Star families across this nation by establishing Gold Star family memorial monuments, so that our Gold Star families have a place where they can go and recognize the loss of their loved one and that legacy of their loved one that sacrificed all for the freedom of this country. I'm also on the board of directors for the Vietnam Veterans Memorial Fund, because it's very important to me. That is something that I have to do, to be on that board, because it is the legacy of our Vietnam veterans that people in our country must never forget, the sacrifices and freedoms. And that is something for me is very personal.
Oh, I can see that. Oh, definitely.
And I'm also on the board of trustees for the National University System, because I believe education and certifications is a key to leveling the playing field for many of our Americans and many of our people that live in our country, by bringing them and getting them the education that they need. And so that's those are organizations that are very, very, very important to me as I lead VVSD.
Well, you know, one of the things that, do you know where the other wall is, the Vietnam Wall? It's in Springfield, Missouri. Did you know that?
I have heard of it, yes, yes.
And one of the gentlemen that I'm on in their organization, Veterans in Defense of Liberty, they just did a motorcycle ride with vets to the wall.
Wonderful.
And we're doing the inaugural program in Washington, D.C. of the Champions of Liberty, and it's open to all vets.
Wonderful.
And I'm very, very fortunate that I'm in the auxiliary part of that, and can't wait to teach a lot of people out there the Constitution, why communism should not be something that you want. And, you know, seeing people that are, I was very fortunate to live all over the world and live under areas of where there is communism or socialism or whatever. And I think kids just think they're entitled.
Yes.
So we need to get out there, and the best people that can do that are our vets.
Yes.
And especially Vietnam vets, because it really does help them to be able to talk about it. I just lost my brother-in-law, who was a lieutenant or captain in the military, the Marines, who just died in January and was buried in Arlington. And, you know, the one thing that really helped him was his reunions that he did every year with his unit. And it was just so wonderful to meet them. So I can't thank you enough for your mission, for what you do, and for what are your dreams for the future for the organizations that you're working with, Kim?
About that, one, that the legacy of those who fought and served for this great nation is never forgotten. Right. I think as we see as time goes by and maybe our conflicts and wars go on, it starts falling out of the minds of people.
Right.
And we can never forget. We can never forget. We can never forget those families that are coming home. And when we serve, so do our families.
That's right.
And so you can never forget the effects of service on the spouses and the children. And they are dealing with a lot of challenges as well. So organizations and communities need to be proactive. And they need to outreach to these families, because they're amazing. They're amazing families.
They're wonderful families.
So, and they can contribute so much to a community. But there's challenges. The children of our veterans and the children of our service members endure so much, more than any other group of children. And so we need to ensure that they have every resource available to be successful.
That's right.
Because they are the leaders of tomorrow. And if there's no one that's going to understand service and sacrifice more than they do.
Now, you work with homelessness.
I do.
Tell us a little bit about your organization.
So VVSD, which is Veterans Village of San Diego, was founded in 1981 by 5 combat Vietnam veterans.
Wow.
As they returned home, they were kind of looking for services that they needed. They felt isolated. They were falling into homelessness because they were unemployed, dealing with mental health issues, dealing with addiction issues. They couldn't find what they wanted, so they started their own organization. In 1990, they were able to gather enough money and purchase an old pink hotel, which is right across the street from MCRD, the Marine Corps Recruit Depot, San Diego. And that's where they established what is called, the actual 501c3 name is Vietnam Veterans of San Diego. And that's where they started their treatment program, their rehabilitation program. Over the course of time, as we all know, we had newer generation of veterans returning home, dealing with some of the same issues of isolation, drug addiction, mental health challenges, homelessness, unemployment. And so they started outreaching to them and saying, do you know what? We need to do more for the newer generation of veterans, so let's start doing business as Veterans Village of San Diego and being available to offer these services to all generation of veterans. Currently, I serve over, my staff and I, which is about 170 strong, serve over 3,000 veterans a year.
Wow.
At any one night, we house over 450 veterans, homeless veterans and their families per night. I have 2 residential treatment programs that offer case management, therapy, substance use disorder, job training, job placement, and then placement into permanent supportive housing. I have 3 transitional housing programs, and then I have a temporary bridge structure, which is for very chronically homeless veterans, but they're not ready to live in a place of their own, but it gets them off the street. It ensures that they're safe. They can sleep well at night knowing that my staff is there 24 hours a day keeping them safe. Their stuff's not going to get stolen. They're not going to get beat up at night. They're going to get food. They have access to showers. They have access to laundry services. They have access to mental health services. And if they need to go to the hospital, we'll drive them to the hospital. I just also opened up a 54-unit, 104-bed permanent supportive housing apartment complex of 1-bedroom, 2-bedroom, and 3-bedroom apartments for homeless veterans and their families. If they have vouchers, we can house them permanently. And then I just also opened up last month a mental health clinic, the Stephen A. Cohen Military Family Clinic, for post 9/11 veterans and their spouses and their children and the dependents of active duty service members, because mental health service is very important, especially early intervention and prevention. And this is fully funded by the Stephen A. Cohen and Alexandra Foundation, which they donated $275 million of their own money to set up a network of 25 mental health clinics across the nation. In fact, there is one of the Stephen A. Cohen Military Family Clinics here in Dallas, run by MetroCare. And it is a very important network of military family clinics because it's outside of the VA, but it's in partnership with the VA. And the VA is very supportive of this because if we can do a greater good for more populations, then together we are stronger. Together we will succeed because our families, our futures, and their lives depend.
I want to thank you. I'd love to support your mission. I'd love to come there
You're more than welcome
and
to
see
come
it.
visit
I
anytime.
really would. Half my family lives in California, and I was just near the San Diego area this summer for our 50th wedding anniversary. So,
well, look us up on our website,
I will.
vvsd.net.
Okay, say that again. Tell them where they can support you.
vvsd.net, and we have a listing of all of our programs. And we have a donate button, so if you feel you'd like to support us and donate, it costs money to take care of our veterans, and we are always looking for people willing to support us.
Thank you so much. It's been a pleasure. I'm so honored to meet you. I can't tell you.
Thank you.
And we'll be back next time on Kathryn Raaker's World.